Rory, extra therapeutic factors in supervision. What are extra therapeutic factors?
Extra therapeutic factors are those elements that are outside therapy. So just a little background to this. In 1992, a psychologist called Michael Lambert undertook a huge research project to try and work out how therapy worked, what made therapy have the best outcomes for clients. And he came up with something called Lambert's Pie. It's not something you can go to the shop and buy. It's a pie chart talking about what factors influence positive outcomes in therapy. And in that, he said that client variables and extra therapeutic events made up 40% of positive outcomes. So in supervision, it's really important that we think about elements outside of therapy. And for those of you who've been in supervision, you may recall that sometimes your supervisor says to you, what's going on around this client? What's happening externally from the therapy room? What support has this person got in place? How's this person coping with this and that? And interestingly enough, that's a deliberate practice from a supervisor to gain a sense of what support systems are in place externally. So I will give you an example. If you've got a client who's going through a difficult time but has a good friendship group, very solid family, is looking after themselves, then almost certainly they're going to have probably a better outcome in therapy than someone who hasn't got that external support. Basically, what it's saying is that therapy just doesn't all happen in the therapy room. It's not all about the therapy room. It's about what's going on externally from the therapy room that's supporting the client in a transition, because all therapy is a transition, moving into maybe a new way of thinking or adapting to a new circumstance, Ken.
Wow, that's a beautiful introduction. And there's two sides to this, I think, Rory, for me, when I was researching this topic and diving deep. There is, as a supervisor, we're looking and considering the extra therapeutic factors in supervision for the clients that a supervisee might bring. So we're asking about their greater lives, as you've beautifully introduced. But we're also looking out for the lives and what's going on in the lives of our supervisees as well. So it's a double-edged sword there where we're looking out for both. And I guess if you're not a supervisor, then you can listen to the point of, are you thinking of this when you're working with your clients, thinking about the external lives within that? And I think it's really important because it keys into the hierarchy of needs for me. So if you think about the basics that are needed, like protection and security and maybe food and water and the basic needs that we have, if you remove those from a person's life, it is unlikely that they're going to engage in meaningful therapy. Why? Because external factors within their life are influencing how they can connect within therapy and how that process may go. And I know that's a very extreme case of this, but there are other factors that happen in our clients' lives that can help or hinder the therapeutic process. And it's interesting that there is another version of this which is spoken about in recovery. So that's drug and alcohol and gambling recovery, so addiction recovery. And it's called recovery capital. And the evidence clearly shows that despite the treatment model that is used, what is a great factor in determining long-term abstinence or recovery from what the person presents with is recovery capital. And it's the factors of their life. Do they have meaningful relationships in their life? Do they have a healthy life? And looking at, I guess, not just the person and the narrative, but who they are, how they live, what's going on for them. So that all becomes part of the therapeutic process.
Yeah, I think that's beautifully put, Ken. And I like that, the idea of having capital, in other words, having a reserve that will allow someone to fall back on emotionally, a bit like having a kind of emotional bank account you can draw on if you're not getting a general emotional input. And that could be if someone's going through a very difficult relational breakup. It might be that they're getting the warmth and kindness and love from their friends and their family, and that's supporting them. Or even things like financial stability. If someone's lost a job and they're very worried about that, I would imagine it's a heck of a lot easier to be in therapy and be able to look at self if you can support yourself through that transition. If you're literally thinking you're going to be made homeless at any minute, then it's very difficult, I think, in therapy to focus on self. And I also think that you touched very correctly, Ken, on a supervisor checking out the counsellor's own well-being, because this is important as well. We know that things like burnout, stress, and some clients can really test our emotional resilience. So it's really useful for a supervisor just to check in. How is the supervisee doing some of that sort of process, that normative, formative, and restorative, the restorative side of things, making sure that they're taking time for themselves, because counselling is a demanding profession. I also think it encourages reflexivity. I can't tell you how many supervisees that I've worked with who really blame themselves if clients don't turn up or clients aren't getting what they perceive. And this is always a danger, I think, for therapists to judge progress by their own frame of reference. Progress should always be judged by how the client thinks they're progressing. They might say, this client's not turned up, or they're not doing very well, or I've tried my very best. And I think by a supervisor saying to a supervisor, well, look, what's the outside support? What's happening in their lives? I think it can be, if not reassuring, can show that people who have lives where they're supported externally are more likely to get a bigger benefit from therapy. It may be harsh, but in my experience, it's a kind of strong truth, Ken.
Yeah, of course. And it's interesting. So we speak about psychological contact. And certainly if you follow the person-centered approach to counseling, it's recognized as being necessary within a therapeutic relationship. And what psychological contact basically is, it's the fact that the person coming in for the therapy knows why they're there. They are engaging because they want to be there. It's that personal motivation from the client. So that is something that we can think about. Now, I say this because I know you've worked before in a school setting, Rory. I've worked in a college setting before. And sometimes you'll get somebody coming in because they've been told, you better go and see the counsellor now. You need some counselling. They're coming in. There's very little chance of having any deep, meaningful therapeutic relationship if somebody is coming in from that point of not particularly wanting to engage. So that's an external factor that is vital to the relationship. So it just shows that who that person is, their mindset, their social support that is around them, their personal motivation, their own coping abilities, meaningful events within their life are all going to be part of who they are when they sit down as a client. In the same way, the supervisee, when coming to supervision, also brings all of that within themselves. We've got a great handout on this as well that you can really deep dive into. And one of the things I was looking over is why this is done in supervision. And the points we got here are the counselor's own well-being, burnout, personal stress, emotional resilience, affect personal effectiveness, how effective that counselor can be with their client. So as a supervisor, you're looking out for that. And then, of course, client social support, relationships with family, friends, community networks play a crucial role in their progress. Don't be surprised if your supervisor starts asking about your client's life outside of just the therapy narrative that is being brought. And this is the spotlight on why that is important for us going to supervision, but it's also important for us when we're working with our clients, Rory. A very interesting topic.
It is a very interesting topic, and I think also it's an encouragement for collaboration. Sometimes therapy itself is part of a wider endeavour where clients might engage with other professionals, social services or medical professionals or community resources. You spoke very eloquently about the recovery community, Ken. That would be a really good example where someone might have counselling, but they may have some other form of support put in place. They may have medical issues, they may need housing and that type of thing, community resources. So I think that part of the supervisor's job is to try to take that 30,000 foot view of what's going on between the client and the counsellor, maybe suggest some form of referral pathways, if it's quite clear that what's being discussed in therapy and what the client hopes to get from therapy isn't something that a therapist can deliver. So an example of that is someone who may be wanting to recover from severe alcohol use. It might be that, although therapy may be very helpful to discuss the reasons that they're overusing alcohol, it may be there's another piece of support that can be put in place to help them if they really want to withdraw from alcohol use. So yeah, supervisors do ask these questions, and I'm wondering how many people listening out there are going to say, oh, so that's why my supervisor asked those questions. I never really knew. I just answered them, but never really understood why they were so interested in what was going on externally of the client.
Yes, or you may be listening to this and going, but my supervisor never covers those areas, in which case both sides of that coin are interesting. And as we led into this, I spoke about the two sides of the coin. One, we're looking at this through the lens of being a supervisor and working with a supervisee. But the other side of it, if you're not a supervisor as a counsellor, how are you bringing this into your client work? And if you are interested in becoming a supervisor, counsellingtutor.com, we have a clinical supervision training course there. And one of the things we hear so often, Rory, is how individuals will take the supervision training course and say that it really impacted how they choose to practice. Practical strategies for supervisors, this is the last bit on the handout that we have, is to create a safe space for reflection, holding that safe place so that your supervisee can come in and feel safe to be able to share what is going on for them. Access workload and self-care, looking at the workload, how many clients that the supervisee is seeing, how they are taking breaks and looking after themselves. Encourage collaboration. You went into that just now, Rory. That is so important that we speak about what's going on for us as counsellors with our supervisor, bringing in the more challenging aspects of our lives if they are there, so that they're on the table, not hidden away. And model awareness of extra therapeutic factors, which is what we're talking about today, knowing that it exists and that it is part of what we do. And then this is an important one, provide guidance on resilience and adaptation. And as counsellors, we don't always guide and advise our clients. Not all models work that way. Specifically person-centered, you might not be directing, but there are times when we recognize what is going on within a client's life might fall outside of our competence range or our ability to be able to help with that. And this is where our referral network comes in really handy, so that we can maybe deliver a little bit of psychological education and maybe a referral pathway to how a person might engage in something if it does fall outside of our competence, but definitely has an impact on maybe the therapeutic relationship or journey. Any final thoughts on this, Rory?
I think that if you are interested, look up Lambert's Pie, which is a massive piece of research. Therapy is a pie with many slices, and there are many aspects to successful therapy. So have a look at Lambert's Pie. And one of the things you might find, and may find surprising, is within that pie, the therapeutic modality is only 15% of the overall success of therapy. So that could be quite eye-opening for a lot of therapists. But it's proven research. It's been around for a long time. It keeps getting re-brought out in research. So I think it's really interesting. And I think if you're a supervisor, I think most supervisors should know what Lambert's Pie is personally, even if you can't buy it from the shop, Ken.
So this is why considering extra therapeutic factors in supervision is important for counsellors